Friends, I'm continuing this online POKI course in step 3. This is a very interesting step where you learn how to find change ideas and how to test the various change ideas which can be sustained in your practice. These are the steps in quality improvement which you have gone through step 1 and step 2. In step 1 you find identifying a problem, forming a team and writing an aim statement. And step 2 you have learned analyzing the problem and measuring the quality of care. In this step you will learn developing and testing changes, and after that will come sustaining improvement. So the learning objectives for this part of step 3 is how to come up with ideas about what to change to reach your aim. So how do we get ideas and how do we find which ideas should be tested in order to find one idea that works? So for developing changes, we have to determine possible change ideas that may lead to improvement. There may be a change idea which may not lead to improvement, but to further deterioration also. So you have to choose those ideas which are likely to lead to improvement. So in your team meeting, you have to ask your team, then based on their own analysis, what do they find? What changes can be made? Okay. The team has to come up with the ideas. So every member of the team can tell you, let us modify this thing, let us change this thing, then probably some good change can occur. And then you have to ask ourselves that why will this change result in an improvement and why not in deterioration? So that those arguments have to be documented. And further, you have to also discuss how this change idea is going to work. The mechanism of this change idea, you have to discuss that part also, because without a proper mechanism, no idea is going to work. So what will we expect to see as a result of this change? So whatever change we make in our processes, in our systems, so how this is going to be affecting our problem. So what do we expect that what is going to happen after this change idea is implemented? Okay, so these are the 4 criteria for finding a change idea. And this change idea, the team members have to come up with this change idea. Okay, it is more likely to happen that you have more than one change ideas. Some teams may have 6, 7, or 8 change ideas. This is very common. Okay, so then you have to find that which change idea is to be tested first. So you have to organize changes according to their importance and practicality, their feasibility, the time required for that change idea, the items required for the change idea. So depending on their significance, importance in the problem which you are working on and practical utility of that change idea in your system, then you have to decide, and in the order of some merit, you have to list all those change ideas. And then you have to select which change idea is to be tested first. Mind it, you have to test one change idea at a time. You cannot make several changes. If you make several changes, then you will not be able to find out that which change has worked, which change is working, on which change we have to emphasize on, which change we should sustain later on. So you have to test one idea at a time. Okay, I will give you some of the examples, some categories and some description of it. So this idea can be improved knowledge or skills. Very often teams will find that there is some lack of knowledge, lack of awareness about a particular issue. Then you have to document it. Then probable solution may be a training or finding the standard how a particular thing should be done. At times you find various wasteful processes are there. So you have to eliminate waste and stop doing useless or harmful things. Sometimes reassigning tasks. It is possible that one person is doing too many things. Then you have to change who does what, and this reassignment can work in some systems. Then reorganize tasks. This may happen that something is being done in a particular fashion, in a particular sequence. For example, during childbirth, you take care of child in a particular sequence. So you may find that this sequence is not so good. This requires some changes in it. So maybe you can do some task in different order or in different location. So some change in the sequence in which the task is being done can bring out some good improvement. Improve patient relationship. When patient satisfaction is not there, or maybe they are complaining too much, then probably this is the change idea. This may come that listen to what patients want. You have to build in your system that counseling process will be done regularly. You will listen to the patients regularly. Probably that will satisfy them more with your system. Reduce variations. You may find that in different shifts of nurses, different types of things are happening. Some are doing as something in the manner which you want, some are doing in a different way. So various variations are not good in any system. Something which is to be done should happen in almost similar fashion today, day after, and tomorrow, every time. So variations are not good in any particular system. So if injections are to be given, they have to be given in the same manner by everyone. So reducing variation can also be a very, very good change ideas. So some more examples about it. So when you want to improve knowledge or skills, you have to teach about the importance of skin to skin care to keep babies warm. See, unless you are convinced that this idea works, this change works, this is an effective thing, you will not be doing those things. So when you teach about the importance of skin to skin care to keep babies warm, when nurses and others are convinced, yes, they will be implementing it more clearly and more often. So this may be one change idea. Very often various teams find that training the staff is one change idea which is likely to improve the clinical care. Eliminate waste. So have equipment closer to hand to reduce time getting it. Sometimes you require something which is kept at a distance. For example, hand washing things. If they are kept at a distance, then compliance to hand washing will be poor. So you have to eliminate this need to go to that place, hand wash, come back. This takes time, this takes efforts. So you have to eliminate such wasteful time and wasteful efforts. This is about the eliminating waste. For reassigning tasks, so one thing which is being done by one person, that can be divided amongst 2 or 3 persons. Then these things may be rather easily doable. Reorganize tasks. As I was discussing that around care of the baby around birth, there may be some reassignment when we do things. So skin to skin care and drying babies can be started before cutting the cord. Actually, the cord is cut between 1 and 3 minutes after the birth. If a baby is normal, cried immediately, then this baby doesn't require any other thing. You have to put it on the mother's abdomen, dry it, and begin skin to skin care within first 1 minute itself. So some of changes in your process in the sequence which you take care of the newborn baby, probably they will be better. They can reduce hypothermia. They can improve your breastfeeding rates. And this can be a very, very good thing in the neonatal care. So improve patient relationships. So this may be one example that you have to learn from others how they would like care to be provided during delivery. Yes, respectful maternity care is very, very important, where you tell mother or pregnant woman who has come for delivery to choose one person who can remain with the mother during her admission in the labor room and during delivery also. So you have to talk to the mother and ask the mother which may be the best person or which she likes to be remaining with her during this process. So in building this process that we have to ask mother about the birth companion, may be a great idea so that mother is comfortable and everything happens so smoothly after this. So this may be one change idea which you can bring in your process. Reduce variations. So maybe you may find that in your various shifts, the priority given to various patients who are coming to the labor room may not be appropriate. So you may have a system of tries of new admission in the labor room. So this will reduce variations in various shifts when various different peoples are on duty. So friends, these are some of the ideas only, some of the examples only. What will work in your setting is to be decided by you and your team. No literature search, no suggestions, no advice from anyone else are likely to work. Something which works in your facility, the same thing may not work in the similar circumstances in other facilities. So change ideas have to be very, very unique in your same unit. Maybe the same problems in two different wards in your own hospital may require different change ideas. So please ask your team to give change idea, list them, prioritize them, and find the best one which is more easy to do, quickly to do, maybe done within a very short period. Then you are ready for testing this change idea and for the next PDSA cycle. So next you will be exposed to the PDSA cycle, how to test various change ideas. Thank you very much. That's all from my side.
Hello and welcome to this part of the online Poki course. This is the part 2 of the step 3. So till now we have identified the problem, we have analyzed the problem. So by this time the health facility teams have decided what they want to improve, formed a team, identified some of the causes for poor care, developed some measures to indicate how our project is progressing. After diagnosing the problem, the team now must take actions to correct it. This involves developing ideas about what to change to fix the problem. So we will now discuss how to test these ideas in our own workplace to learn if they work and to adapt them to your setting. So the learning objectives would be to how to plan a plan, do, study, act cycle or a PDSA cycle to test the change ideas. What to do as you learn from a PDSA cycle and how to test multiple change ideas to achieve your aim. So, what exactly is a PDSA cycle? Now, PDSA cycle is the plan, do, study and act cycle. Plan is planning the change, do is testing the change, study is knowing what did you learn from the change, the test, and acting is what are the next steps that we plan to do from this testing, whether to adopt, adapt or abandon. Now, we need to understand that it is rare that any change will work perfectly the first time. It will usually need some adjustment to work in your setting. And because of this, it is important to test the new ideas to learn how they work and to adjust them. The PDC cycle is therefore very useful for this particular aspect. So, in the aspect of planning, what will your team do? So, what change idea will you test? So, who will make the change? Where will this test be done? When will this test be started? For how long will this test be done? How will we know whether this test happened as planned? And what do we expect to learn from this test? Now, it is important to emphasize that a team can do a small PDSA cycle very quickly. For example, when someone is cooking and they decide to add salt and see if it tastes better, they are doing a simple PDSA cycle. Similarly, teams can do short PDSA cycle to learn how new ideas are working and to adapt them. What is important is to understand that when we are doing a PDSA cycle, detailing is the most important part. The questions of what, who, where, when, for how long, and how will we know that we actually did the test? And what do we expect to learn from the test? These are some of the questions that really need to be answered at the end of the test. So, for example, what change will you test? A new protocol for postpartum assessment to pick up PPH early. PPH is postpartum hemorrhage in the ward. So who will make this change? So in your team, you have two nurses who are involved in developing the protocol. So you have assigned that the two nurses will do the change. Now, where will they do it? They will test the protocol in the postpartum ward. They are posted in that ward, so they are comfortable doing that test in the ward that they are posted in. When will they test? Where they will do the test in the very next shift. Now, it's very important that we assign that task at the next possible shift and not postpone it to some time later when the entire momentum is lost. Now, how long will they test it? They will test on one shift only. Now, if it's a small change, like we said, PDSA does not have to be a very big change, like adding salt to food. So it does not have to be a very big change. So depending on the test that we are doing, they can test it on one shift only. And what do you want to learn from the test? Is it actually feasible to follow protocol? Say for example, for postpartum assessment, we want to check pulse every 2 hourly in a 8-hour shift. Do we need to adapt the protocol? Are the nurses able to follow this protocol in all postpartum women? Do we need to change anything in the ward to make it easier to follow protocol? Like for example, can we make a protocol in which all the newly delivered women are put to one side of the ward and the women who are maybe day 2 or day 3 of the delivery are put on the other side so that nurses are able to do it more easily? So this is adaptation of the protocol. So do we need to do some further changes so that this particular idea works better? So this is the example of adaptation of a PDSA cycle, or what do you want to learn further from a PDSA cycle. So when we do the test, so the previous was planning the test. When we do the test, sometimes the plan might not happen exactly as envisioned. Say for example, the sister started doing it, but a lot of patients delivered that night and she could not do the test as planned. So it's important to document exactly what happened, as there is valuable learning. The simple learning could have been that if there is an overload of patients on a particular night, it is not possible to follow that protocol on a particular night. So it is very important to document exactly what happened at the time of your PDSA cycle. So that is the do part of the test. Now, study. After testing the change, you need to think about, was the test carried out as planned? So that is the number one part. If it was not, why? What else needs to be done so that this change can happen? So if it was not done in the first place, say for example, the sister was on leave or she could not do it in the first place, can we reschedule doing the same plan? Or if it was not feasible, then do we need to change the plan? Do we think that changing the plan will solve the problem? Does the change improve our indicator? So the team should review what they learned from the test, whether it is feasible in our work setting, whether it was successful in addressing the problem as hypothesized by the team. So this is the study part of the test, and it's very, very important that the study part of the test is done earnestly, honestly, with an understanding that a failure is not that we learn from failures. Now, the next part is the act part. After reviewing the results of the test, the team decides whether the changes should be made. Should be adopted. The change was perfect, the change worked well and led to an improvement in the data and is feasible and acceptable. So that's an ideal situation. The first idea that came to our mind worked so well that we adopted it without any further change. Adapted, the idea worked partially but needs some modification and further testing. This is usually the most common scenario. So this is what happens, that okay, it worked partially, but maybe this needs some more, tinkering, some more change to be accompanied for a perfect fit. Abandoned, that the change idea did not work at all. This is not going to work in our setting. So this we need to think about a completely different and a radical change. So that is what the other idea is. So, uh, testing the changes. Important thing about when we are doing the test is that we need to test big changes on a small scale. Like we discussed, do for one shift. Let's not take out a big order that now every postpartum women will be seen every 2 hourly by all the nurses on a shift duty, whether it is possible for her or not. So it's very important that if we test on a small scale, there won't be any harm, and it provides an opportunity to learn, and it also allows you to make modifications to your idea before we apply it on a large scale. And as much as possible, it is good to test each idea individually. Otherwise, you won't know which idea led to improvement. Say, for example, we want to test training as a change idea and versus some other system improvement. So let us do training first and see how much of an improvement it has brought, and then maybe we'll work on other ideas. So as much as possible, we should learn to do individual changes, test individual changes. And most importantly, negative results are an opportunity to learn. Negative results should not always discourage us, and they are always an opportunity to learn. Think about how conditions change over time. So it is not always true that what happens during the day duty is the same thing that happens during the night times. And in so many of our QI projects, we have seen that, simple things like hand washing, they are done properly when they are being supervised. But it doesn't happen when things are at night and you're tired. Simple things like your skin to skin care, it happens so nicely during the morning hours, may not be happening to begin with when when the staff is less at night. So we need to understand the monthly patterns, the seasonal patterns, the duty variations, and most important variation is a new staff joining. Especially postgraduates join every 6 monthly, new postgraduates coming in. So these things do change. So how is the pattern changing over time? So all of these things, variables, have to be taken into consideration. So as we said, no QI project will reach its aim with only one PDSA, and you will need to do multiple PDSAs depending on your analysis and identified causes and change ideas. See, in this example, multiple change ideas were tested to reduce hypothermia in newborn babies, and some of these change ideas were abandoned, like Ziploc bags, and some were adapted or adopted. So, like we discussed, try to test one change at a time. The changes in the illustration can happen at different times in our health facilities. So different changes can happen at different times, but as far as possible, if we do one change at a time, we can know what contributed to how much of a change idea. So the difference between uh, testing a change idea and implementing a change idea is that when you are doing it in a small way, there is less resistance, it takes less time, less support is needed. You can just take a few people, make a team, and then you can, do a project. And tolerance for failure is low. Okay, your idea did not work. You can just say, okay, this does not work, and it's an opportunity to learn. But while you're implementing the changes, you can expect more resistance. People will say, what you're doing? People will ask questions. And it takes more time and more support is needed at all levels. And if your idea does not work, then the tolerance for failure is less. So implement only those changes that has been tested and has showed improvement. So the key tips would be that testing is important to make sure that you have selected the right change idea. So you need to keep testing the change ideas that are based on analysis. So if you've done a good PDSA cycle, you've studied your change ideas, you've analyzed your change ideas, then you're sure that the change ideas you've tested and implemented, your implementation is based on good testing. And you also have to make sure that the effect of change has been studied on a small scale. And change ideas that are successful can be made a routine practice, and those that are failed are abandoned. Because it's important that these change ideas are adapted to local context. A QI project which has been done in some other center may not be applicable to your center. So ideas from other settings may be good in theory, but need to be tested in your own setting for a proper adaptability. And many times we need to do a PDSA cycle for a good adaptation. So that is in nutshell about the PDSA cycle, and I love saying that PDSA cycle is like the smallest unit of a quality improvement project. And please remember that PDSA is not just plan, do, study and act. It is also please do small alterations. Thank you.